We're here with a patient who traveled from Virginia, and you had the Deuk Laser Disc Repair done at L4-L5 for back pain. How do you feel today?
I feel great.
Is that back pain still there?
No.
Gone.
Yep, it's gone. Just a little numb where you went in.
Now, you're an interesting patient because this is your second surgery here. You came in February, so you were here about, 5 months ago?
Yep, February, yep.
And you had a gigantic herniation at L5-S1. We did the laser surgery at L5-S1. We got in there and used the laser to clean out the herniation. Tiny little scar, no hospitalization, no pain meds. Well, you were a little bit of pain afterwards, but that went away. You were doing fantastic.
Yeah,
right?
doing great, doing everything normal. I wasn't lifting a whole lot, but out of pain and moving.
And getting back to life.
You're right.
And then 2 weeks ago, you were getting in your truck, right?
Yeah, I was getting in my truck and I just felt a little sharp pain, a little bit higher than the first one, and it just progressively got worse.
Yeah, then you reached out to me by phone because you have my phone number.
Right.
And I said, let's do a Zoom call and an MRI, and we did the MRI. And I fully expected that there would be a reherniation because 1% of our patients get a reherniation. That's 1 in 100. And I thought, well, he probably reherniated 5-1. So when we got the MRI, there was no reherniation at 5-1. Your pain was actually, as you said, a little bit higher, which was 4-5. So you had an annular tear with inflammation at L4-5 causing your back pain. And you had the Deuk Laser Disc Repair a second time, but this time it was at L4-5. And here you are with a smile on your face, right? All right. So hopefully you're not coming back to Duke Spine anymore.
Right. Right. But if I needed you, I would.
Yeah.
For sure.
Thank you. Anything you want to share with your audience out there?
Yeah, I mean, it's just been great because I dealt with the medical system back at home in Virginia, and they wanted to do the, what do they call it, where they remove the disc?
Discectomy, fusion.
The fusion, and I didn't want to go that route. And everybody I heard, the testimonies about Dr. Deuk were great, and my experience has been exactly like I heard. So I just, I keep thinking enough.
You're welcome, my friend. Come here. You're welcome. I'm sorry you had to go through this, but I'm glad you're feeling better now.
Yeah.
All right. Thank you. Let's get you out of here.